for you. This is Chris Hayes earlier on this network talking to Ned Lamont, the governor of Connecticut.
Danbury Hospital is already at capacity, and they have 200 nurses who are on furlough because they were in contact. If I could test those nurses, I could potentially get them back into the game
Wait a
lot
second.
sooner.
You've got 200 nurses sitting on the sidelines right now who can't get back to work because they can't be tested to confirm whether or not they have the virus?
Exactly.
Doctor, you heard the governor. My question for you, how on earth has this been allowed to happen?
This is something that's surprising to all of us. Nobody thought that the chink in our pandemic preparedness armor would be diagnostic testing. And we've seen cascading failures when it comes to diagnostic testing with the scale up. And this isn't something that is going to make anything better for some time, because we even have test kits now available, but it's still so bureaucratically hard to order them. I was rounding over the weekend in the hospital and I had 2 tests denied to me because they didn't meet strict criteria. We have to get away from this idea that you had to have contact with somebody that's a confirmed case to order the test. This has really been paralyzing for doctors. Then you have the guidance that says if you've been exposed to somebody or if you were in a hospital setting, these workers have to be quarantined. And that's going to be paralyzing for hospitals, especially like you just heard from the governor of Connecticut. This isn't something that we can expect to continue and be able to respond. Hospitals are at crisis mode right now in certain parts of the country, and it's only going to get worse if we don't get our guidance in line and have testing available for healthcare workers and have good return to work type of guidance for them, because it's just something that we never expected would happen in the United States with the pandemic response.
And Jonathan, this is the president who at the CDC with cameras rolling said to Americans, if you want a test, if you need a test, you can get a test.
And he did so wearing his campaign hat. There's been such a scattershot approach from this White House so far, to the frustration of some of the people around the president. For a few days there, it seemed as if the vice president and Dr. Fauci were sort of more or less talking with one voice, trying to present facts, information, guidelines to the American public, while the president himself would seemingly be dealing with a different crisis altogether. In his tweets and in public comments, it seems so detached from reality. That changed a little bit today, although again, we'll see if it lasts. I wouldn't bank on it. But there's certainly seemingly a new understanding of how dire things are right now and how it's only going to get worse. We heard the president today. He agreed with the idea there could be a recession, which of course is a toxic concept for any incumbent heading into a re-election year, which he of course is. Something he didn't want to dare mention any time before. He of course, as we discussed, said this would wrap up in a couple of weeks, and now he's saying it will be months. This is an administration, they're waiting for the Senate to get into session, not just for this funding bill, but there's going to be more. There's going to be additional funding. There's going to be talk of a major stimulus needed to prop up the economy here as the real effects of this get worse. And more than anything, that is what this White House is bracing for. Because that they are seeing that if they suspect that the number of cases are going to surge in the next few weeks, and Americans really don't know what's coming.
Steph, go ahead.
Brian, I would just say, and people across the board are wanting solidarity from business leaders, medical professionals, and the White House. And Jonathan makes a great point that the president is making this turn today, but it was earlier this morning his economic advisor, Larry Kudlow, reiterated that this is a good time to buy stocks if you're a long-term investor. I can tell you, some of the biggest investors in the world right now do not care whether or not it's a good time to buy stocks. They see this as the massive health crisis that it is, and it is not just Larry Kudlow. Yesterday, Treasury Secretary Steve Mnuchin said he doesn't see a recession coming. Survey any professional investor on planet Earth, and they will say, yes, without a doubt, we're going to face one. We're in one right now. It's a global recession. So to see the White House continue to try to play this down, the only way to actually solve for this is to open it up, not play it down.
To Jonathan Lemire, to Dr. Amesh